Hi, this is Juliet from PRADHAN News, and today we will discuss about signs of miscarriages during early pregnancies. So, let's get started. Spotting in early pregnancy is fairly common, but it should never be considered as normal. If you are experiencing spotting, cramps, or sudden loss of pregnancy symptoms, don't panic. Those symptoms can be normal too, but do not neglect that. So, do call your doctor to make sure you are not having a miscarriage. Some women do not experience any symptoms of miscarriage at all. However, they undergo miscarriages. So, here we will discuss about the possible signs of miscarriages, which include bleeding, mild to severe cramps, nausea and vomiting, decreased activity of baby, loss of pregnancy symptoms. So, let's get started with the first point, that is bleeding. Vaginal bleeding that may be light or heavy, constant or irregular. Although bleeding is often the first sign of a miscarriage, first trimester bleeding may also occur with a normal pregnancy, but bleeding with pain is a sign that miscarriage is more likely. So ladies, you shall call up your doctor for your baby's health as well as yours. Second, mild to severe cramps. Basically, during our pregnancy days, we at times feel cramps. So you may have pelvic cramps, belly pain, or persistent dull ache in your lower back. Pain may start a few hours to several days after bleeding has begun. The pain may be located in the abdomen, pelvic area, or lower back, and can range from dull and aching to period-like cramping. It may be difficult to distinguish if the pain is normal, since round ligament pain and even cramps can be common during early pregnancy as your body expands for the growing uterus. Nausea and vomiting. Basically, during the first trimester of pregnancy, we generally experience a nausea and vomiting, but excessive vomiting and nausea is an indication that sometimes is wrong. Little bit of morning sickness is obvious, but excess is the wrong symptom. With such loss of fluid, you tend to dehydrate and can also lead to miscarriage, so please take care and visit your doctor. Decreased activity of the baby. The majority of miscarriages occur during the first trimester, but signs of a loss later on in the pregnancy may be different. One of the primary ways to determine your baby's health is staying attentive to his or her activity. If you notice a sudden or drastic decrease in the activity, be sure to let your doctor know so how he can determine if further testing is necessary, like ultrasounds. Change in pregnancy symptoms. Less common but still noticeable symptoms of a miscarriage could include a decrease in pregnancy-related symptoms such as nausea and vomiting or breast tenderness. A blood test to measure the level of pregnancy hormones can be done to determine if the pregnancy is still viable. Unfortunately, there is no proven indicator of a miscarriage, so be sure to speak to your pregnancy health care provider if you are experiencing any of the symptoms or have concern about your own risk of a miscarriage. Ultrasound reports can also help you to come to a conclusion. Hope you gain knowledge and like my video. Thank you for watching my video. This is Juliet from PRADHAN News, and please do not forget to subscribe and like my channel. Thank you.